Does one of your parents have heart disease? Or perhaps the problem has occurred somewhere else in your family tree? Whether you have distant or immediate family members who've experienced some sort of heart disorder, you're probably wondering, what are my chances of eventually living with hereditary heart disease? In this video, we'll cover a few types of hereditary heart disease, other variables that may play a role in developing heart disease, and a few things you can do to protect your overall wellness. So, does a family history impact your chances of developing heart disease? Yes. Heart disease can be passed down from family members. First, bear in mind that there are different types of heart disease. Heart disease is a rather large umbrella term that includes coronary artery disease, congenital heart defects like problems with a heart valve, heart failure, and dilated cardiomyopathy. Types of hereditary heart disease include coronary artery disease. The arteries that carry blood to the heart become narrow or blocked. Cardiomyopathy, which also comes in various types. It becomes harder for the heart to pump blood effectively. Arrhythmia, such as prolonged QT syndrome and Brugada syndrome. The individual has an irregular heartbeat, or the condition puts them at a higher risk for irregular heartbeats. Sudden arrhythmic death syndrome. Unexpected cardiac arrest leads to death. Familiar hypercholesterolemia. This disorder causes high levels of bad cholesterol, low density lipoprotein or LDL cholesterol. It's important to note that just because you have a family history of some type of heart disease, that doesn't guarantee you will also experience cardiovascular disease. Rather, you might just find yourself at an increased risk. This is because there are various factors that can affect your likelihood of developing heart disease. Genetic components are one, but so are lifestyle habits. Let's talk about that next. So, what lifestyle habits put you at a higher risk of heart disease? How you treat your body on a regular basis can make or break your mental and physical health. This means that certain daily habits can negatively impact your heart function. These risk factors include smoking. The toxic chemicals you inhale when you smoke cigarettes, cigars, etc., can damage your heart tissue and blood vessels. Drinking alcohol. Excessive alcohol consumption can increase your risk for high blood pressure, heart failure, and stroke. Not getting enough sleep. In particular, fatigue can lead to arrhythmia and high blood pressure. A sedentary lifestyle. Excessive sitting has been linked to both high blood pressure and a greater risk of cardiovascular disease. Carrying excess weight. Obesity increases cardiovascular demands, and this raises blood pressure among other risk factors. Not finding a healthy way to manage stress. High cortisol levels can increase blood cholesterol, blood pressure, and more. Not following a healthy diet. Consuming saturated fats, trans fats, and cholesterol can increase the risk for heart disease. High blood pressure. High blood pressure can increase the workload for your heart. High cholesterol. Cholesterol can accumulate in the arteries, forming plaque. This makes the arteries more narrow, which can decrease and even block the flow of blood to the heart or even the brain. Research says that there's also a connection between depression and heart disease, although the exact nature of that relationship is still a bit of a mystery. So, as you can see, while genetics do matter, a family history of heart disease certainly isn't the only determining factor at play. So, how can you protect yourself against heart disease? Whether you're concerned about inherited heart disease caused by lifestyle factors, or some combination of both, as is often the case, there are certain things you can do to take action and improve your wellness. If you're concerned about inherited heart disease, genetic testing can help determine if you are at risk and may even be able to determine the cause of your heart disease if you end up getting diagnosed. Genetic counselors analyze your family history, explain the different genetic testing options, interpret test results, and determine the next steps you can take. In some cases, simple lifestyle changes can drastically reduce and even eliminate some of these risk factors. If you live a sedentary lifestyle, which is common considering so many of us are desk workers, try incorporating daily walks or use a standing desk throughout your workday. If it helps, set an alarm to go off once an hour so you can get up and stretch your arms and legs. Following a healthy diet can help you lose weight, tackle high cholesterol, and achieve lower blood pressure, a win-win-win. You don't have to be perfect. You're still human after all. Try to eat a nutrient-dense diet 80% of the time, and the other 20% of the time, give yourself a little more breathing room. Not only will cutting back on or eliminating smoking and drinking reduce your risk of developing heart disease, but it will also provide countless other benefits, both mentally and physically. Plus, remember that smoking doesn't only harm you, it also harms the people in close proximity. In both of the stated instances, a cardiac risk monitoring panel can also be beneficial. This is a comprehensive screening that provides insights into your risk of heart attack, stroke, other cardiovascular diseases, and much more. It looks at your cholesterol, inflammation, iron, body fat, and other markers. This panel requires fasting for 8 to 12 hours prior to providing a blood sample, and results are delivered to you in 4 to 7 business days. Should you have questions after receiving your test results, you can follow up with a clinician. Get your panel at one of eNational Testing's 2,000 plus locations. A family history of heart disease, even if it was first degree family members, doesn't mean you are doomed to experience the same. Genetic testing, a cardiac risk monitoring panel, and healthy lifestyle choices can go a long way in protecting your body for years to come.